hospital systems face down this new wave. So I want to commend the mayor's decision, because it's never an easy one to make, but it's the right one. I should also note that the city of Chicago is doing better than the rest of the state right now when you compare its current hospitalization levels to those in the spring. So let this be a model for action for the rest of the state. What about if the hospitals become so overrun that you're sick and you're dying have nowhere left to turn? Because I promise you, while you fail to take responsibility in your city and your county, that day is coming closer, and it will be on you. While the rest of us will still do our jobs, the state will do all that it can to help hospitals surge their capacity and find additional staff. Healthcare workers will take up their posts on the front lines as they have every single day since this began. But more people will get sick, more people will struggle to breathe, and more people will die because you've failed to do your job. While good people do the right thing by wearing masks to keep each other safe, elected leaders in some communities have allowed others to infect their constituents because they're afraid of the few loud anti-maskers, or because the elected leaders themselves are anti-maskers. In too many of these communities, responsible business owners have followed public health guidelines, only to see competitors flout the rules and prolong the mitigations for everyone else. There may be a vaccine on the way in just a few months, but a lot of lives can be saved before that happens. And when this is over, there will be an accounting by your constituents of who worked to keep the public safe and who just ignored the science. This is the moment to step up and get it right. Winter is coming. Folks, I've pledged to be honest with you throughout this COVID crisis, and that won't ever change. We're running out of time, and we're running out of options. Our growth in new cases is now exponential. We are seeing current numbers and future projections worse than what we saw in the spring. We're more practiced at responding to this virus now, so we have significant stockpiles of PPE. We have overflow capacity that's already planned by our hospitals, and we have much more testing available. But that won't slow the spread of the virus. Since the stay-at-home order ended in May, we've allowed local governments to make decisions about whether they needed tougher mitigations and enforcement, and we've only imposed certain select mitigations at the state level on a regional basis. Those tools worked where people acted responsibly in local communities. But with many community leaders choosing not to listen to the doctors, we are left with not many tools left in our toolbox to fight this. The numbers don't lie. If things don't take a turn in the coming days, we will quickly reach the point when some form of a mandatory stay-at-home order is all that will be left. With every fiber of my being, I do not want us to get there. But right now, that seems like where we
This
are.
is your Ghetto News reporter, Mary Dash, 20 Mary
If you're
Lee.
sitting at home and wondering
Today is
what
November
you can do to help prevent
15th,
this and to stop the
2020.
spread,
I'm
well,
listening to the
wear your
Dare
mask when you're
Denard
out,
Show.
and stay home if you can. And while you're home, give your county board chair or your local mayor a call.
Comes on at
Ask them
6
what
a.m.
they're doing
in my
to
city,
enforce
Chicago.
the doctor-recommended mitigations. Ask them
My
what
time
they're
is an
doing
hour
to
early. I
keep
haven't
you
set
and
my
your
clock
loved
back.
ones safe.
Listen.
And we just heard Governor Pritzker's remarks about the spread of the pandemic in Illinois, and he commended Mayor Lori Lightfoot on terms of the action that she's taking with regard to protect Chicago and its advisory. It's a pleasure to be joined right now by Mayor Lightfoot.
Listen.
to talk
Lori
about
Lightfoot,
what
Mayor of
exactly
Chicago.
is in this advisory and what it means for the residents of the city of Chicago.
Pay
Mayor
attention.
Lightfoot, how are you, and what exactly is Operation
It's your Ghetto News reporter, Mary Dash, 20 Mary Lee.
First of all, it's always a pleasure to be with you and your listeners. Really, this is driven by the fact that we are continuing to see a very disturbing rise in the number of cases on a daily basis, hospitalizations, ICU beds, and and unfortunately, the number of deaths. So we knew that we had to take some bigger, bolder steps. The Protect Chicago really has 3 components to it. It's a stay-at-home advisory, and we're telling folks, if you don't need to leave your home, don't leave your home. And we're really encouraging people, no guests in private restaurants. So whoever's your household, let that be your bubble. Unless you have a need to have essential workers in or educators, stay home and don't let people in. Avoid social gatherings, especially indoors, even with friends and family. What we're seeing is a significant rise in cases coming out of those private settings, homes, dinner parties, other gatherings, or in private venues. Those are the places that are hardest to regulate, but those are the places where we're seeing a significant uptick in cases. We want people to avoid all non-essential travel and cancel those traditional Thanksgiving celebrations. If you stay in your bubble with your household, don't invite other people in. We know that's tough, but we've got to hang in there. We're going to put this in place starting Monday and for 30 days afterwards.
Do you anticipate the city having to go through the measures that it did back in March and April in terms of literally transforming McCormick Place into a triage center?
Well, I sure hope not, but having been through that experience, while I don't think it'll be a McCormick Place, there are other facilities in the area. Like, for example, the closed hospital, Metro South, that was retrofitted at the same time, and if it's necessary, it's there. It will be pretty turnkey, and the same medical personnel that operated McCormick Place are available to step in if the need arises. We're hoping that by taking these and other measures, and we're talking to not just about Chicago, but looking to our regional partners. We've convened a working group through a number of different mayors' caucuses. Their first kickoff discussion was actually today. So this has got to be an all-hands-on-deck moment, but it can't just be Chicago. Given the fluidity with which people travel to and from Chicago for work, for leisure, we've got to have a regional strategy. That's why we started engaging our partners from suburban Cook and the surrounding counties.
We understand the need to have that partnership with the surrounding counties, but what exactly do you say to these disgruntled restaurateurs and people that work for them that say that we cannot survive in this particular type of climate right now with regard to the restrictions?
Look, it's really hard. I'm not going to sugarcoat it. It's very, very difficult. Our restaurants, bars, hotels, the hospitality industry in general, they have taken a beating over the course of this year. That the shutdowns have fallen disproportionately on them. There's no question about it. We have been in dialogue and partnership and collaboration with them from the very beginning, and certainly we know what their pain points are. Unfortunately, we're in a situation with the second surge where we've got to first and foremost take the steps that are necessary to truly save lives, and our restaurateurs absolutely understand that. It's still painful for them. They're still closures. They're still hanging on by a thread, but I'll tell them our reason why all the rest of us have got to step up and own this moment, because if we do, then we can start to see case rates go down, and then we can ease restrictions and get people back on their feet.
Much is often said about so-called COVID fatigue, and I'm reminded of not only the Depression, but also World War II, where the restrictions that people had to encounter and deal with were far more severe than wearing a mask, washing your hands, and social distancing. And yet we see this reticence in terms of following these particular guidelines, and at the same time, what I think is a false narrative, trying to equate something in the health sector with something that exists in the free speech sector, saying, well, hey, I don't want to wear a mask, and you can't force me to because it's my freedom of speech rights that are being hampered.
Well, unfortunately, our current president has, I think, really hurt our efforts all across the country by politicizing elements of the public health messaging and tools that we know work. It's not a partisan statement to not wear a mask or wear a mask. It's a question of life or death. Every
You are listening to Lori Lightfoot on the radio, the mayor of my city, Chicago. It's your ghetto news reporter, Mary Lee.
Because you're going to be taking in things that you don't want to. You're going to be hurting other people.
Today is November the 15th, 2020.
The lowest common denominator here has a disproportionate impact
Sunday in my city, Chicago.
We've got to make sure that we are linked arms in this together. And I say linked arms, and I really mean with social distancing, of course.
Exactly.
But we've got to be in this together because
it's exactly 7:04. That's say 8:04. But I have yet to set my clock back.
And so we're telling people, be smart, be diligent, and don't be selfish.
Yeah, and it's interesting to know just how negatively impacted the efforts that are promulgated by the state as well as the city dealing with these limited resources, and
Don't
yet
forget
not
to wash your
getting
hands.
a reciprocal type of input from the federal government. And speaking of the federal government, I would be remiss, Madam Mayor, if I didn't ask you with regard to
They call her Madam Mayor. Lori Lightfoot is on the radio. The Dale Denard Show comes on at 6 a.m. in my city, Chicago.
The results of the election, where Biden is an overwhelming winner and everything comes out the way the press has projected, he's going to end up with the same number of electoral votes that President Trump did back in 2016.
Yeah, we've been following these cases very closely, and there was a comment by someone that the Trump legal strategy is basically a bunch of press releases with a court caption on it. You've seen how these state court judges all across the country, in Michigan, Wisconsin, Pennsylvania, and elsewhere, have just been swatting these away because they're frivolous. They're conjuring up the specter of fraud and illegality or incompetence that is absolutely belied by the facts. And so, for example,
I respectfully disagree. I believe Joe Biden is trying to steal the election, even though they say he has won. They still are going back and forth, kind of like the Bush and Gore presidential race. So it's still up for grabs.
Look, it's unfortunate that Donald Trump's last gasp is going to be trying to sow chaos, which is his brand, right? But sow chaos and try to delegitimize our elections. And finally, you're starting to see a few Republicans stand up and say, not true. Yeah. Not true. The election went off well.
All right. I got basically what I need for today. I was told later part of this week that, matter of fact, on Friday the 13th, 2020, in my city, Chicago, that I had to remove my things from the youth storage self-storage place where I put my stuff in on November the 3rd of 2020. Now, for no apparent reason other than, I'm your ghetto news reporter and originator rap, and I'm exposing things such as, child abuse, pedophilia, things that I have gone through, personally, imposed on me as a child, and that's still going through because I'm exposing it, So after a month, they said I had to vacate their premises or whatever after moving everything on the bus or whatever and stuff. I'm the only person that handles my business. So they was talking about a lockdown, things of that nature. But they say if you have business, then you can continue on with your business. I try to tell them at the youth storage, let me, do what I have to do or whatever. So they basically was going back and forth. I'm having the same problem at the trap house I'm at. You understand what I'm saying? I filled out a maintenance report or whatever because I've been here over 3 years and haven't gotten anything, even fresh paint on the wall, and this is supposed to be government funded. You understand what I'm saying? Real talk. And they never painted it from the person who was here before me in 5 years, and I've been here almost 4 years, so that's almost 10 years. So long story short, I got a lot of problems, and I have to deal with them myself, and so I'm just making sure that I can, go out and handle my business, and that's what I plan on doing. And I suggest you all too, just handle it early and get it up the way. And with that, this is your ghetto news reporter, Mary-Dash between Mary and Lee. Take it one day at a time. Peace.